Hi, this is Dr. Taylor, and today I'd like to talk to you about shoulder pain. Shoulder pain is a very common condition I see in my office on a daily basis. And your shoulder, if it's not functioning properly, can really affect the quality of your life. It's hard to lift weights if you're a weightlifter. It's hard to, just your regular daily activities, reaching for things, reaching above the head, reaching back. All of this can affect the shoulder. And then what happens is, people stop using their shoulder and this gets more fixated and it becomes a frozen shoulder. Frozen shoulder is very common. So when you're not using it, all the muscles start to tighten up in here and then you lose your range of motion, and that creates other issues for you like neck pain, elbow pain, mid-back pain. And so it's important to have healthy shoulders. Now let me talk a little bit about the anatomy of the shoulder. Your shoulder consists of 4 joints. It consists of your acromioclavicular joint, your sternoclavicular joint, your glenohumeral joint, and your scapulothoracic joint. It's a very complex joint consisting of 4 joints. It also, as you can see, here's this bone called the humerus. The humeral head sits into this glenoid fossa. It's a very shallow glenoid fossa here. It's a very shallow joint, so it's very susceptible to injury. Being shallow, it gives you a greater range of motion. It's one of the most mobile joints in the body. However, it is a joint then that you're going to have the most risk for injury, and this is why people have shoulder problems. So what can you do to help prevent to have shoulder problems? Well, you got to keep all the joints in the surrounding area maintained and loose. That's why I recommend regular chiropractic care, someone who specializes not just in the spine, but just in the extremities as well, keeping all the joints loose and balanced. That's big. But what you can do on your own is make sure that the muscles here in the surrounding areas are loose. And you can do that with a tennis ball. So if somebody has a shoulder problem here, you can do the tennis ball directly on the areas of the muscles. That can sometimes bring some relief. But you got to be careful because sometimes that can aggravate more things. That can be more aggravating to the shoulder. What would be better yet is to work the surrounding muscles. So you can lay on your back, let the tennis ball work on these paraspinal muscles, the neck muscles, even using it on the muscles of the forearm and the tricep and the bicep. When these muscles are looser, that can often take relief off of the shoulder. So using a tennis ball, just lying in that area is going to be very, very helpful. You can do that on the floor or on your back, on the wall, either one. Now, what exercises can you do for the shoulder? Well, one of the ones that I like the most, if your shoulder, you don't have a problem in through here and you're trying to prevent, is doing a barn door, just like this. Come all the way back and all the way forward. Another one that you can do is like you're holding a golf club and you're going to hold it like this and reverse back here like this and forward like they do 20 times each. That's good for strengthening the shoulders and the back. Also, what you can do is just stand here with the table here like this and just push back. And that'll help push things back and strengthen these muscles in here. A lot of times people are pushing everything forward. You know, they're on their phones, they're texting, they're looking down. That rolls everything forward and causes imbalances here in the shoulder, so you gotta bring things back. That's why I like this exercise, that's why I like this exercise, and this one. And so what muscles really get tighter, muscles here in the front. So one of the things that I like to do using the tennis ball is lying on right here, just right in the pec. Let it dig in there. Hold it for 5 seconds and then move to another area. Keep that area loose, and then immediately you can go on a door jam here and start stretching this. Hold that for like 20 seconds. That alone can bring some relief to that shoulder. So after doing all this, if you still have shoulder pain, then I'd recommend getting treated by a chiropractor who really specializes in extremities. And again, if you have shoulder pain, a lot of times you work the elbow and the wrist and the scapulothoracic joint. That can really help alleviate a lot of the pain, even this joint over and through here. I just had a guy today come in, he had a lot of shoulder pain. We adjusted his elbow, it fixed his shoulder. So that's how it works sometimes. Now, after doing the adjustment, sometimes that can help alleviate the shoulder and you can be clear just with the adjustment. But sometimes you may need technology, or you may need to work on the adhesions. So we use different technology in our clinic for shoulder, but one of the most effective is using the shockwave. The shockwave is powerful for clearing out and fixing shoulders really quick and making them function so much better. So what you do is you get on the joint here in the back, and you just you do the areas, you break up the adhesion, you get the right areas, and you can see some miracles as far as shoulders being cleared in just a matter of 1 to 3 visits. Kind of depends, and sometimes it may take more depending on how complex the problem is. So I hope this video has been helpful, but you don't have to live with shoulder pain, know that. And there are other options that are natural, but the key is preventing those from happening in the first place. And I hope this video will help you accomplish that. So this is Dr. Taylor signing off. Shoulder up.
Straight up or sideways?
Yep, sideways.
Sideways.
Any pain with that?
Right here.
Okay. All right, on a scale of 1 to 10, how would you rate that pain?
Like a 6, 7.
Okay, bring it in front of your body.
Less, like a 4.
Okay. All right, how about when you go like this? Any pain with that, or this?
This pain, yeah.
How would you rate that
like
pain?
a 7.
Okay. And then bring it back. Any pain with that?
Little. Like
Okay.
a 4.
All right, go ahead and bring the arm up now. How's that feel?
Good.
Oh, you're moving so much more fluid. Any pain at all?
No.
Went from 6 to 7 to what now?
0.
0. Okay.
Yep.
Do this action here. Any pain with that? Nice. What do you think?
Real good. Love it.
Yeah,
Feel
good.
like I could throw a baseball again.
Yeah, good. All right,
Left
great.
hand.
That's the power of the shockwave, the pressure wave here.
Woo!
Yeah.
Bring your guns back.